we writ large, the big we, have to understand that there is a trust gap that exists today. And so when we speed with development and don't take into account properly that gap, effectively what we do is widen it. Dr. Michelle von Hunderen came to us and said, can you help me be more efficient in an emergency room setting? A hospital is not unlike a lot of businesses that we deal with, where they've got more demand than they have supply. So in his case, he's got more patients who need attention than they've got physicians in the intensive care unit. We worked to develop a model that allows him to deal with, in his particular case, gastroenterology patients coming out of surgery. Now, they have an evidence-based medicine approach to dealing with those patients. And so we took some of the rules associated with that approach and baked them into the model. If you have a model that's going to maybe create an itinerary for your next vacation, that's one thing. If you have a model that's going to create a treatment plan for a condition coming out of surgery, that's a different level of emphasis required. We want to make sure at the earliest possible stages where something might go awry in terms of the decision making that's happening in a model, we need to know that, right? But that's not unlike any other clinical practice, right? You start off usually in a lab, then you promote it to a small cohort, and then you go to a larger population. So this is very consistent with that clinical practice, and it's the way science is done in a healthcare setting. What a model registry then does is allows you to take these models and apply some different characteristics to them, right, metadata and so on, and then describe their usefulness in these multiple settings. And so over time, you can start to see kind of this compilation of models and how effective they might be, not just in one location like Erasmus Medical Center, but now you can say, well, we have cancer patients in another hospital in Amsterdam. We have gastroenterology patients in a different hospital in Sweden. Why wouldn't these models apply there as well? One model dealing with the same sorts of conditions, but now we need a way of encapsulating information about those models, and that's what the model registry is all about. We're still in a nascent space right now as it relates to this current instantiation of AI. It's what we will refer to as an emerging technology. And when you've got emerging technologies, you've got to be prepared to adapt to the emergence. We're going to discover some downsides, and we've got to make sure we have policies and rules in place that allow us to adapt appropriately as we discover those. And so it's important that as we race to create net new, that we do so in a way that is sensitive to the human beings that we are impacting. And we can't just give lip service to it, but we've got to show up with the goods as well. I think what this time calls for is for us to start reimagining some new models, not just the AI models, but the business models to accompany them.